again this week with co-op student Hannah. I hope you enjoyed our videos for the last couple weeks. I thought they were well done, well as away. What are we going to talk about this week, Hannah?
This week we're going to be talking about frozen shoulder.
Yeah, another name for frozen shoulder is a very painful condition. Called adhesive capsulitis, and one of the thoughts is that you have this capsule that encompasses everything in your shoulder, and that capsule can get very inflamed and very red. We don't really know why it happens. It happens more with women between the ages of 40 and 60. It can kind of start with some minor trauma to your shoulder or immobilization for some reason, but we don't know why it starts. It kind of starts with kind of a gentle ache and just progresses. There's generally 3 phases to being in a frozen shoulder. The first phase is called the freezing phase.
Yeah, so this phase can last anywhere between 3 months to a year. We're not really sure. As Dr. Jeff said, it starts out with a little bit of an ache in your shoulder, kind of loses some range of motion. So the first range of motion to go is the external rotation. So one arm will be able to go pretty much the whole range of motion, and the other arm will just stop. The next range of motion to go is reaching behind your back. You can't really reach very far, mostly just into your pocket. And then the next one to go will be raising your shoulder up here. During this stage, we can treat it with massage, acupuncture, physio, chiro, stim, and lots of range of motion exercises to kind of prevent it from going to the next phase, which is called the frozen stage.
Yeah, the frozen phase, it just hurts. It's very painful. Nothing you do makes it feel better. Generally you'll take medication, try and sleep. But nothing you do, there's no sense in doing any physio or any more chiro or anything during the frozen phase because nothing's going to help, so you're just going to be wasting your money. But once it does start to feel a little better, that's when you can start up again with some more exercise, and that's called the thawing phase.
Yeah, so during this phase is when you can start back up with the chiro, physio, massage to kind of get those range of motion back. Pain can occur sometimes, but definitely not as much, so this is when it starts to get better. And again, this stage can last anywhere from a few months to a year. It's not very known.
Yeah, so frozen shoulder can be very painful. It can last between 9 months to a few years. It's kind of self-limiting that it does kind of get better on its own. With therapy, you can get better faster. The whole idea is that if you start noticing they're getting frozen shoulder in that freezing phase, is really to work on the exercises, try and keep the range of motion going, and try and prevent it to getting into that frozen phase. Because once it's frozen, you're kind of toast. You just have to wait for it to come out of it before we can start to exercise again. There's another explanation for frozen shoulder, and this is called the OTZ or 1-2-0 theory. Now what that theory is that you have a nerve, one of your cranial nerves that comes out of your skull. It's called the spinal accessory nerve, and it goes down and innervates a bunch of the muscles around your shoulder. And what can happen is this nerve can get pinched. And if the nerve gets pinched somehow up in there, that can affect the muscles in the shoulder. They get weaker, they don't function properly. And when you try and lift your arm up, they can't lift the collarbone and the shoulder blade up in order to let it rotate. So your arm gets stuck. It's just not going to move very well. And what they have found is that there's a special adjustment that some chiropractors do, and it's called the OTZ or the tension adjustment, to try and release the pressure on that spinal accessory nerve. And it's only a few chiropractors in Ontario that do it. I went down to Dallas and took a course on it a number of years ago. And what they have found with this technique is that about 82% of people will get between 75 and 100% improvement within 28 days. Only 2% of people didn't get any improvement over those 28 days. So it's very effective in treating frozen shoulder. Again, there's not too many chiropractors in Ontario that do this, but it has been shown to be very effective in treating frozen shoulder.
Awesome. So if you have any more questions about frozen shoulder or anything about the OTZ method, feel free to let us know, and Dr. Jeff can kind of explain it more.
And again, if you like our video, give us a big thumbs up and share it with your friends.
As always, I'm Hannah, here with Dr. Jeff.
And we've always got your back.